The International Federation of OBGYNs recently issued a report saying that most prenatal vitamins have toxic ingredients. And the problem goes way beyond prenatal vitamins, but there are clean supplements available. So let's talk about it. Hey everybody, it's Dr. David. Hope you're doing well. A board certified pediatrician here in Tampa, and I've been worrying not just about what children are exposed to, but my work led me way before that to the preconception pregnancy phase, which is kind of how I landed here and what we're going to be talking about today. Now, of course, most importantly for me is education. Educating people to let them know what they are stacked against, let them know what their options are, and in this case, let them know how they may be exposed to toxins that they did not know about. Now, we're going to talk today about why prenatal vitamins are so important, which, of course, some of that is duh. But we're also going to talk about the prevalence of the toxins in the vitamins and what you can do in order to ensure that you're getting the cleanest products possible. Now, we do 2 of these videos a week. Please subscribe to our YouTube channel if you're not subscribed already. Please share this information with others as well. This is really important information, and if it's not relevant specifically for you, you probably have a family member, a friend who is in the pre-pregnancy or pregnancy mode, and they probably need to know about this. So first, let me talk about this little backstory. So 18-ish or so years ago, I was doing heavy metal testing on some of my patients who had with autism, because we had found some heavy metals high in them. We were doing detoxification, and there were 3 different kids who all within the same 2 weeks started putting out a metal called antimony into their urine as part of the detoxification profile. We had never seen these metals in these kids before. I recognized that all 3 of these patients were taking one particular zinc liquid product from a supplement company called Kirkman Labs. Kirkman was the first company really to go to market with supplements specifically to for children on the autism spectrum. We ended up narrowing it down to figure out it wasn't the zinc product, the zinc itself, it was the stevia in the liquid, the inert ingredient that contained the antimony. And out of result of this, they actually went and checked other companies' stevia and found antimony was in most of them. They then went out and bought a mass spectrometer, which is a machine that detects minute amounts of many different things, including toxins. And they found that a lot of the raw materials that were being sent to them were problematic. They then went out and set to find clean products that did not have any of these toxins in there. Now, as a result of that, they then asked me to help them to create a prenatal vitamin that had the types of higher end nutrients that I'm looking for in my patients, but also that would go through this, what they then termed the ultra clean, ultra testing process, where they looked at 650, I believe, different toxins that they could be checking for and making sure that none of them were showing up in any of their supplements, not just into the prenatal. But that's kind of the way it kind of became. Larry Newman, who was the chief chemist at Kirkman at the time, dear friend of mine, we ended up creating a whole bunch of other products relative to this. It was as a clinician, I don't usually get an opportunity to create products, but it was really wonderful to have the opportunity, as well as to be asked my opinion on something that was so important. Now, in terms of what is the importance of prenatal vitamins, obviously, it's because of the nutrients that are in there that are often found to be lacking in the pre-pregnancy, pregnancy, and lactational phase. Now, of course, we know that folate, super important for brain development, spina bifida. A defect in the spinal column can happen when a person is folate deficient, as an example. We call neural tube defects. Iron. Of course, iron is absolutely necessary for a fetus to grow blood, but also decreases the risk of complications from postpartum hemorrhaging of the mother. And of course, the list goes on and on. But the International Federation of OBGYNs has advised that during pregnancy, a woman does need folate, iron, calcium, vitamin D, choline, omega-3 fatty acids, B vitamins, and vitamin C. Now, let's talk about the problems. Inaccurate assumptions about the cleanliness of supplements. So it's falsely assumed that a prenatal vitamin or supplement, if it's a product, that it is a reliable, uncontaminated source of listed nutrients, and in fact, quite the opposite. There are no current global standards for testing of any supplements to determine what is a safe amount or how much is in a particular supplement. And that the manufacturer may claim that the list on the label that this is what they have in there. But without any kind of post-market testing, there's no guarantee that it has any of those amounts that are listed there, or maybe there could be other things that are not on the label that is actually in there. But I guess if you don't look, you can't find. But shame on anybody who's not doing that. Now, studies have demonstrated that prenatal vitamins do contain a significant amount of contamination with toxic chemicals, and also with microbials. A recent review had found that toxic fungi, mold, etc., were found in many of the supplements. And this is actually what I'm sharing here. This is specifically from the report from the International Federation of OBGYNs, which you can see in the notes down below, in the description down below. So you can link the entire paper from there. It's a good read. It's easy to read. It was written for the lay population, but scary because of what it reveals. But that's where all of this is coming from. The same review found that heavy metal contamination was found in 5% of all products, that exceeding the safety limitations, and there was absolutely no mechanism for removing them from the market unless there was a recall done. There was actually another sample of 26 different prenatal vitamins out there, including one of them that were prescription brand that was part of what's given out by Medicaid. 40% of the products exceeded the established levels of lead. And they also found that toxic elements such as aluminum, titanium, thallium, nickel were also found in every one of the samples. Every one. Now, most regulatory agencies are limited to removing the products once they're found to be proven to be unsafe, but not from keeping them off of the market initially. So there's very much a buyer beware aspect here. So with this, the International Federation of OBGYNs decided to take a stand. And let me also just say thank you to the International Federation. It's about time. It's about time. I've been screaming about these problems for 20 years, and it's nice that an organization such as this represents all of these. It's the federation started in 1954. There were representatives from 42 national OBGYN member societies. It's now grown to 139, so it is now global, and that does include the American College of Obstetrics and Gynecologists. This is part of the formal statement. The environmental contributors to reproductive health begins in utero and includes the social, physical, and nutritional environment and physical and chemical agents. Exposure to toxic environmental chemicals during pregnancy and lactation is ubiquitous and is a threat to healthy human reproduction. Number 3. There are tens of thousands of chemicals in global commerce, and even small exposures to toxic chemicals during pregnancy can trigger adverse health consequences. Yes, the largest organization of one of the largest medical groups in the world is saying this. This should be alarming to everyone. Certainly does alarm me. Well, it doesn't shock me because I knew about this, but it's still alarming. But it's also alarming that they're willing to say this, because that's huge. Okay, now let's talk about the solutions. Now, a lot of this is also stuff that the Federation did. So they didn't just point out the problem. They're trying to come up with solutions. They say that most effective thing to do is to be testing products post-manufacturing, but pre-market, before it's sent out, to make sure that there's no toxic chemicals or contaminants that are present. The committee for the International Federation of OBGYNs, they have what's called the Committee on Climate Change and Toxic Environment Exposures, and what they did is they brought together a team of global scientists, environmentalists, who made these following recommendations. Number 1, creating a list of toxic chemicals and contaminants that should be screened for in prenatal vitamins and reduced to specific standards. Number 2, conduct tests of existing vitamins to assess ongoing risks to maternal and newborn health. Number 3, very important also, expand this to do this annually. Meet every year, see if there's anything new out there. So as an example, we've talked here on this channel, and there's certainly been a lot of news about plastics, nanoplastics, microplastics. Now, this is really just a story of the past couple years. This is a story actually that has happened since the OBGYN started working on this. So the plastics aren't even part of what they're talking about right now. But I certainly would anticipate, now that all of this information is, that this will be coming out in future annual reports for them. Okay. So now also in the description, if you look at the link for this article, you can find the list of all of the toxins that they say need to be tested for. It's an impressive list. You will notice that there's quite a few there that you probably have never heard of. A lot of them being a lot of the pesticides that they're out there, but also the other toxins. Okay. So their position for of the Federation, International Federation, microbial and heavy metal contamination, adulteration with synthetic drugs, and substituting herbs should be forbidden. Potentially toxic environmental chemicals should not be found in products consumed or marketing for pregnancy health. Again, a no-brainer, but this is the formal statement. They're establishing standard of care. That's really important, because establishing standard of care means that people now have repercussions, that if there's organizations, if there's manufacturers who are going against standard of care, there's more repercussions that can be had because of that. Okay. They also said plainly, and part of what I'm doing here, so hopefully there's clinicians watching this as well. If not, maybe share this with your clinician. Educate clinicians to the impact of toxic environmental exposures in personal care products, as well as food, water, and other means that people could be exposed. They then went on to say clinicians, they should collectively be advocating for regulatory changes in their countries. They should only be recommending products tested by outside laboratories for quality as well as for purity. And they said that we should also be educating consumers about the risks of using unverified products. Wonderful information, right? What we've been doing here all along. They then went on to say that manufacturers, they also need to be held to a standard of production that assures the safety, and minimizes all the contaminants. They are now calling for a certification of all prenatal vitamins, and that becomes standard of care. Now, at this point in time, there is only one prenatal vitamin that passes what the criteria is for their certification, and it happens to be the prenatal vitamin that I helped Kirkman create all of those years ago. So I'm not surprised about that, because I've been following the story and working with Kirkman on this, and so I know that this is where it is. Certainly something I'm very proud of, to know that we led to this in the first place. I mean, really, this was the origin story. This is what happened a long time ago, is what led us to here, and I'm just super proud of Kirkman. I guess I'll toot my horn a little bit here, but yeah, it's because of this work that is leading to this now global movement, which is amazing. Okay, now Kirkman, they don't just wait to make the product and make sure that it's checked post manufacture pre-marketing. They now check every single raw material before it even comes into their plant. The end result of that is that the wholesalers, the manufacturers of the raw materials, they know, they test beforehand. They know that Kirkman's going to reject it, and they're going to have to pay to ship it all back, and they're going to have to destroy it all. And the sad thing is that because one of the questions that have come up is, will there be enough raw materials that are clean? And the manufacturers of these raw materials are telling us that for a couple dollars more per bottle, they can do it. Okay, it's going to take a little extra work to do it. And of course, finding it, manufacturing it. So it's going to be a problem for a while, but it's clearly there. Okay, now, of course, with this whole standard of care, then, I do have to wonder, besides the fact that thank God it's just enough time, and thank you again for the International Federation for bringing this up. But the other main point here is that other companies better comply. Because you know what? Once the standard of care is being set, that is going to open them up to lots and lots of civil lawsuits, class action lawsuits, etc. Government regulation, that moves way too slow, if it happens at all. We know the regulations have been, of course, depends on the administration, the federal administration, but regulations a lot of times have been cut, not enhanced. So if you're not going to do it, but what talks? People talk. Pocketbooks talk. And hopefully the companies will figure this out sooner as opposed to later. Okay, frustrating, but a little glimmer of hope that we have this hopefully figured out. So once again, please do subscribe to this YouTube channel if you haven't already shared it. Also, if you're not a Patreon subscriber of ours, please do so you have access to information early, as well as protocols that we don't share with the general population. Have a great day.